your approach when treating a patient with tendonitis. So like guidelines. So more rest, ice kind of thing versus loading the tendon, isometrics, those kind of exercises.
Right, so we're gonna think about this differently for the classmates watching this, or anyone watching this. Where did the tendinopathy, tendinosis, tendonitis come from? Usually it's from inhibition, because so this is the muscle, tendon, fibers, all that stuff, right? But this cannot work correctly if the electricity zapping to this fiber isn't working correctly either. So if there's a problem with this junction, this cannot have proper tension length to do what we need to do wherever the tendonitis is. So if there's a tendonitis, tendinosis, tendinopathy, it's most likely coming from a problem with that neuromuscular connection. So that neuromuscular connection is inhibited. If it's inhibited, it's either, to keep it simple, it can be too stretched sometimes, but sometimes it's not working right. It's not, there's not enough tension on it to have the right tension on the joints. And if there's not the proper tension on the joints, the stuff at that joint is moving constantly throughout the day, and it's rubbing up against stuff, not moving right, irritating over days, weeks, months, years. So a good analogy I heard years ago is, let's just say I do this to my arm, like I just run my nail on my arm for 5 minutes, nothing will happen. If I do this for 2 days, 5 years, 5 weeks, 50 years, something will change in the skin, right? And the same thing happens in other parts of our body. So if that neuromuscular connection isn't zapping right, this isn't working right, and it's just rubbing on these different joints over time, that's where tendinosis, tendonitis, tendinopathy comes from. So how do I treat it? I make sure that connection is firing right to get the stuff moving right, to get the joint moving right. Once it's firing correctly, then we can go into eccentrics, isometrics, concentrics, all that stuff. But we have to get the first part right, because if you try and do eccentrics, isometrics, concentrics, right? If you try and do all that, but it's not moving right, or this tension length, or the muscles like this, let's just say the muscles like this, because the signal isn't making it taut how it needs to be, then you're doing the isometrics on a whack muscle, wimpy muscle like this, and it's just not giving the same therapeutic result how you want it to. So this has to be first. Then you can go into isometrics. I like isometrics first because that does not pull as much throughout the joint. We're still putting tension on it, but not rubbing the joint as much, where it might be irritated in some cases. Then I like eccentrics next.